Patellofemoral pain, or what some people call chondromalacia, is one of the most common knee conditions among active people, including military service members and military veterans. In this video, I'll discuss what patellofemoral pain is, what the common signs and symptoms are, and why it's so common. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Anterior knee pain, or what's in the orthopedic world called patellofemoral pain syndrome, is one of the most common diagnoses of the knee in active people, military or not. Chondromalacia patella, that was the catch-all term that was used forever. We've gotten away from that a little bit now, but it describes sort of a catch-all of any clinical presentation related to issues with the patella or the kneecap. It can be innate, meaning how you are, or it can be acquired factors that lead to the development of patellofemoral pain, whether that's trauma in a specific trauma event, disuse, it can be overuse. All of those are acquired factors that can cause patellofemoral pain, even patellofemoral degeneration, maybe breaking down the cartilage underneath the kneecap. Then you can add insult to injury, so to speak, by abnormal mechanics and kinematics related to how your kneecap lines up and the alignment of your lower body that could put more pressure on this area. Now, technically, the term chondromalacia means the articular surface of the patella starts losing the density of the cartilage, even potentially starting to break down compared to the healthier state. That cartilage can get softer, making it more likely to tear, to fissure, to erode, and then that leads to changes that can actually turn into arthritis down the road. Now, the condition overall, again, I said it was a catch-all description. It typically involves all aspects of what we call the extensor mechanism of the knee, not just the patella, but the patellar tendon, which is the tendon below the kneecap, the quad tendon, which is the tendon above the kneecap. Again, the pathology, chondromalacia patella or patellofemoral pain syndrome, some people call it runner's knee, sort of encompasses all of that. When you hear one, chondromalacia is not separate from patellofemoral pain. They essentially mean the same thing. Now, you don't have to have arthritis or even breakdown of cartilage to have pain. You could go in and scope the knee looks completely normal, but still have patellofemoral pain. Some of the causative factors specific to you, to the individual, are things like lower body or lower extremity malalignment. You can have maltracking of the patella. You can have muscular weakness of the muscles around the knee, like the VMO, weakness of the muscles around the hip. Typically, people with patellofemoral pain complain of a dull, achy pain all along the front of the knee. It's more of a diffuse pain than something like a meniscus tear, where you can typically point to the pain with one finger. Common predisposing issues would be pain going up and down stairs, especially going downstairs. Pain sitting with your knee bent for a long period of time. So that's called theater sign, where you're sitting in a movie theater with your knee bent and your knee starts to hurt and you feel like you need to straighten it out. Pain sitting at your desk in class, pain sitting on a bus, that airplane would be a common type of thing, and it feels better to straighten it out. Typically, you don't have swelling. Typically, you don't have giving way or locking or catching. It's just a dull, achy pain. And as somebody that had it when I was younger, it is really uncomfortable. And very often, these are active people that get it, not couch potatoes, which is why it's seen so common in active duty military members, and it can linger into basically after military service, and that's why so many veterans still deal with patellofemoral pain issues now. Now, if you have ideas for topics for future videos for this channel, whether it's injuries like patellofemoral pain, surgeries, risk factors for injuries, the process of Nexus letters, DBQs, or anything else, leave those in the comments below. Make sure to subscribe to my channel, click the bell up there to be notified when a new video comes out. If you're interested in a Nexus letter for your injury or condition, click the link in the description below this video to learn more about working with me and working with my team. We try to make the process simple and quick for you. We want to make it as easy as possible. And I really work hard to write a Nexus letter that gives you the best chance of success in your claim. Thanks so much for watching. I look forward to working with you much more.